the back like this, a long straw, isn't it? A long straw like this.
I'm a fond of this. Who the guy?
Isn't it? I watched the boot of the water circular motion and here immediately. Watch it thoroughly.
So why are they washing in circular motion?
The pressure area. So isn't it? So here I rinse. Isn't it? I rinse.
Yeah, patient quick. More patient.
I take what? That joint. I dry it.
I'm going to have a video happen.
Isn't it?
We either come over shaken.
Major area at the back go.
In case if there's another one to this one. Yes, it's storage. Yes, it's storage.
I what? If patient was incontinent.
For this one, and Nigeria, you will not compare with the bone, you go stress from there.
I take what? Dusting powder. Like this, apply. So this is plan. You just apply what? Dusting powder. Is the what side? If patient was what? Continent go. If patient was not, was incontinent, you apply what? Vaseline and apply your what? Vaseline there. So isn't it? So after we finish, we turn patient to this position. Isn't it? So that's it our patient. So isn't it? So for this first one, for this we are going to discard it already. We have the final one, or the second one, or the third one, planet, isn't it? Not for drying. We just like what at here butuk or what bits of the what patient. So here is a private area. Sometimes patient may prefer to use his own private part, but you can allow him to do so.
Okay.
If patient can't do, you have what your third planet, isn't it? So you can use it to watch what private area. Wrap it like this. So how you ask? You just put it with your finger. You just put it like this, isn't it? Have you seen? When you fold it like this, you unfold.
Excuse me.
Excuse me. So just you are like this. End portion of it, isn't it? You divide it like this. After you divide, you unfold go. The other like this. You follow with your own this pointer finger. So what you call it? So you just what attach it. So for the final station, you apply it like this. Apply it so, isn't it? You wash what? The size, isn't it? For what? For male, you wash what? His own what private part, penis, scrotum, testes there. Isn't it? For female, you wash what? The vaginal orifice, rectal orifice, all that. You wash it. Isn't it?
Without opening the
one. You wash the sides there. Yes. Isn't it? After you finish wash, you know what? Sometimes a patient may prefer to do it by himself. If she can do, you can watch. Isn't it? You wash the sides, isn't it? After you finish washing thoroughly, isn't it? You know what? You discard your own requirement go. You remove what? Towels, isn't it? And discard it. Just I don't behind it. Just you when you wash, you rinse. After you finish what, you apply soap, you just rinse it. Without what? Applying water, just so no need of more right. So is it clear? So you cover the patient. So you are not yet finished. You take care, isn't it? You come here, you come to your patient here, like this go. So isn't it? So after you wash,
What you going to do for one patient?
You take care. Nail cutter, isn't it? You trim what the patient has, isn't it? Like this. Or your assistant will do this over you by yourself. You are taking the log too. like what? Toenails go and what? Cut them, separate them. Isn't it? So isn't it? So if patient having new clothes, they apply. Or if patient got some of the clothes and come and need to corner up like that. So to take them. So you now what? Apply it again. You apply it, isn't it?
Okay.
You massage every patient face, isn't it? You apply it what? And giving patient what? Hand go, isn't it? And some part of the body, isn't it? And even what? His what? Leg, isn't it? You now cover him with what?